Yep, we're live now. Hello, HHT community, and welcome to another Cure HHT Facebook Live. I'm happy to be joined by Leslie Perry and Scott Olitsky here today. The topic of discussion is back to school. I don't know about you guys, but it's hard to believe that it's back to school time already. Hopefully you've enjoyed the frequency with which we've been bringing you these Facebook Lives. If you have any recommendations on future topics, please feel free to leave them in the comments. But today, focusing on back to school and any tips, common questions to help you set up your children for success as they navigate the complexities of HHT. We will, of course, be making time for your questions. So please feel free to leave those in the comment fields. We can see them as they come up live, and we'll get to as many as we can here today. Before we get in, I just wanted to say that if you haven't, within the next few weeks, please be sure to head over to our website, curehht.org. Our team here has been working on a fact sheet for you to download and bring to your school nurse that lists just some common overview of HHT and the disease, as well as best practices for stopping nosebleeds that might be beneficial to share with your school nurse and start a conversation. So be on the lookout for that in the next few weeks. We'll give everybody some time to jump into the feed here. And while we do, maybe we start with some intros. So Scott, why don't you say hi?
Yeah, good morning. I'm Scott Olitsky. I'm the Chief Medical Officer at Cure HHT. I've been a board member for about 12 years, part of a large family with HHT. And enjoying the sunny weather here in Southern California. Apologize if there's any background noise. We're on the road today and just took a brief stop to join you all.
Hi, my name's Leslie. Oh, sorry.
Oh, no, go for it, Leslie.
Hi. My name's Leslie Perry. I'm a school nurse, and I'm in Maryland, and I work for the HHT Foundation. I don't have it, but I'm good friends with Mary Ann Clancy, and that's how I got involved in working for the foundation. And this during the summer, since I'm a school nurse, I'll be going back to school soon. But during the summer, I work in the BVMC project, which recruits people to be part of a study for patients with HHT and brain AVMs. So some of you may have even seen my name on some emails, or maybe I've even spoken to some of you.
Absolutely. Well, we really appreciate the time from you both and greatly appreciate the perspective both of you bring for the topic in terms of going back to school. Leslie, I'm curious to start the discussion with you. As a school nurse, generally speaking, what's helpful for you to know if you have a student who has HHT? What would be beneficial information that you'd want to hear from the parents to set them up for success for the school year?
Well, I think a lot of nurses will probably not be familiar with HHT. It isn't terribly well known. If you've ever had a student with it, you of course would know all those basic information. So the first thing is to tell your nurse that this is what your student has, and specifically what your students' specific concerns would be. I mean, if they have nosebleeds, what sort of situation will that set them off? Is running around at recess a situation where they might be more likely to have a nosebleed, or is it when they're a stressful situation? Like, well, what causes it, and what you use at home? What helps at home to stop those nosebleeds? I mean, does your child use ice, or do they want to use? Do they just use a tissue? And what sort of things are available at home? And those things can usually be available in the health suite without any problem. How is your student manage this themselves? It may have to do with how old the student is. A kindergartner may need a little bit more attention than a junior in high school, and hopefully that would be the case. So I think just being really upfront with your school nurse about what helps your child and what your child really needs, because everybody knows HHT presents very differently in everybody. So there's not really any sort of, we always see this kind of thing.
Yeah, absolutely. So that's a great response. And I think it transitions well to my next question, Scott, which one for you, which I know we've covered in different Facebook Lives, but probably bears repeating in that HHT, multi-organ, very complex disease, might feel like a rudimentary question, but how would you recommend parents discuss or describe HHT when talking to their school nurse?
Yeah, I think it's important to give a good overview, but probably if you try to go too in depth, you lose some of the forest for the trees, I think. I think a simple discussion about, this is a blood vessel problem that leads to bleeding. If your child, an abnormal blood vessel formation in different organs, and you can let the school nurse know about your specific child's issues, maybe a pulmonary AVM or a brain AVM. But obviously, the most likely thing the school nurse is going to see is nosebleeds, and to have a discussion about um, that these are common. And they can occur, most any time. Certainly, certain activities may increase the possibilities Leslie was mentioning, and what your child can do if they have one. But I think getting into more detail than that, unless your specific child requires that detail be known, probably isn't necessary at that first visit with the school nurse.
Absolutely, very helpful. I know a lot of people will appreciate that. Um, it seems our Facebook Live has international stardom and reach here. Henrietta joining us from Denmark, so we appreciate you tuning in. And also hello to Anne from Louisiana. Hopefully not too hot for you down in Louisiana. But speaking of nosebleeds, know it's a common question, but any best practices, and this can really be for either or both of you in terms of stopping nosebleeds.
I can start with that if you like. One thing, I don't have students at my school with HHT, or at least nobody who's been diagnosed with it. So I'm just talking about just generally nosebleeds, but I do ask students not to tip their heads back, because I do find that a lot of time the blood will run back down into their throat, and then they cough or spit out blood. And sometimes that's more upsetting to them than the nosebleed is. So I usually give them a trash can so they can lean over a trash can. Tissues, we use pretty much tissues in the health suite, although I do have cotton balls, and I also have ice packs that I can use if a nosebleed is particularly flowing one. Some ice packs, and sometimes telling them to pinch the top of their nose helps. I usually try to ask them too if it's one side, if it's usually one nair or the other, because sometimes it can be something that can be treated depending on what the reason for the nosebleeds is. Obviously, HHT it's one thing, but for other students, just if it's a deviated septum or something. So those usually, and then I usually send them away with some Kleenex, because I told them once you've had one today, you're much more likely to have another one. So that's usually how I handle them. And I'm in high school, so I do have older students that I'm dealing with. I'm not dealing with little kids. So, now, Scott, are there some other things you suggest in schools?
Yeah, I think probably the first thing is to tell the school nurse or teachers or athletic instructors, coaches, not to panic. Most HHT families don't think much about these nosebleeds, especially in children, where they tend to not be as severe as those of us who are older. And having been a parent going through this with my own children, I think we all probably know that the children aren't affected by it too much. I remember one of my children having nosebleed on the soccer field, and both coaches, everybody else was much more excited than she was, who was just eager to put a cotton ball in and get back on the field. So I think don't panic is probably a big thing. The other is that most families know how to handle these nosebleeds, and I dare to say probably better than most medical professionals. So most parents, most families have a way to handle these, and it would be helpful to speak to the school nurse or other people at the school about what that individual student's best approach is. I think those would be the top two things I would say to discuss at the time of the meeting with the school nurse or other people at school.
Don't panic, certainly a great tip. As an HHT patient myself, I have this vivid memory being a young boy at our local swimming pool and having a nosebleed and being whisked off in a stretcher by the lifeguards, and thinking, this happens to me multiple times a day. I don't understand why it's a big production. But along those lines, Scott, just from your own children, any other tips besides don't panic, whether it's supplies, conversations that would be best to have? Any other tips you'd give along those lines?
Yeah, sorry, you may hear a plane overhead. So I think Leslie's point about not tipping your head back is a good one. for some people, for a small nosebleed that's, tends to be self-limited, that might be helpful just to keep it from dripping out of your nose onto your clothes, things like that. But, a lot of times I hear patients being told, put your head back. And, the nosebleeds that we tend to get can have, fairly moderate flow to them. And as she was mentioning, if you swallow blood, child can get nauseous, and it becomes a bigger deal than what the nosebleed was when it started. I think packing is useful. Again, many families already have their routine. Sending that with the child, or instructing the nurse that a cotton ball lubricated with some ointment might be helpful, and then giving it some time and removing the packing as needed. I think those are some good tips to pass along as well.
Absolutely.
I just want to jump in here too. I know different school systems do it differently. Now, if a student was going to use just a saline spray, just a plain saline spray, they wouldn't really need to have an order from their healthcare provider for that. But if there were going to be a medication that they were using, even if it's over the counter, most schools do require that there be an order from a healthcare provider. So if that is something that your child uses, particularly I see we have someone whose son is starting kindergarten. If there's a certain medication that he uses to help with nosebleeds, that's something that you should talk to his healthcare provider about and get an order for.
Yeah, and similarly, Leslie, I'll guess, I'll ask you, I don't know how different schools work, but if a child is, an older child who can pack their nose pretty easily, is that something that the school nurse may not be allowed to do because it's, a procedure? Or is that something that the student, somebody can talk to the people at school and say, my student is able to do this, he's got the materials, go ahead and let him or her do that?
As I said, I have older students. So if I had an older student and who I know has HHT and they do this themselves, I would go ahead and let them do it. If I were required to do it, if I were a younger student in an elementary school, I would want a little bit of some guidelines from the healthcare provider about, what exactly I should do, how long should it stay in there, sort of how just for the first time when you're doing something, just to be sure that you're doing it correctly. I don't generally encourage students that come to my health suite, non-HHT students, to put things in their nose, because then they pull them out and then they end up getting, they pull that clot off and it starts all over again. So, but HHT is a different situation, so it would be handled a little differently. But yeah, I would say that it's important if especially for a young child, and if there's specific things that need to be done, it would be very helpful to have a procedure and have the parent come and talk the nurse through it the first time they do it. Just so it gets done the way that the student's comfortable. But if the student's older and can do it themselves, that would certainly be reasonable also. I mean, my feeling is I'm sending all my kids off to college, so I can't be following them around and packing their noses for them, because I'm not going to be doing it after they graduate. So they've really got to start to learn to do some of these things themselves. So I would always encourage students to be able to handle some of their own issues if they can.
Yeah, and I think along with that, it's certainly in an older child, a teenager, somebody in high school, sometimes you want to really pack it pretty tight, and I think we can all appreciate that there are times where we pack it tight enough. It hurts when you're putting that packing in, and I'm not sure somebody other than that student is necessarily going to pack it that tight, especially if they're good at doing that.
Absolutely. Great tips. And it's interesting, stopping HHT-related nosebleeds is very nuanced conversations. So hopefully everybody appreciates some of the tips here. We have Chelsea joining us from DC. We have Jamie from Texas, Heidi from Minnesota, and Natasha from Canada. So appreciate everybody joining in. Please, we encourage you to ask questions here. We'll certainly get to as many as we can in the time we have allotted. Leslie, we have a question from Stephanie in the chat, and I know you and I were talking before we hit go live here about 504 plans specifically and how it is a very complex, nuanced conversation. But any general advice you could give to Stephanie, who asks or says her son is starting kindergarten, has AVMs, suffers from shortness of breath, would that warrant, or should she look into a 504 plan for him?
So Stephanie and all the rest of you, first of all, congratulations on getting your child to kindergarten. That's a big step. It's going to change your whole day. But the other thing is, I think it's important for you to talk to them if they're doing PE in kindergarten, which they might be because they may be in a full day program. Or if they're not, then they'll tell the teacher that, if he feels short of breath, he shouldn't be pushed to do more. Or if he's one of those kids who isn't good at stopping when he needs to stop, that maybe the teacher needs to keep an eye on him when he's running around outside and make sure he does stop when he, if he starts to feel short of breath. As for 504 plan, that's usually not a big problem in the younger grades, because what you want to do is level the playing field for a student that has a healthcare problem. And if they have, if for example, he's out of his algebra class for 45 minutes because he's stopping a nosebleed, he probably needs that 45 minutes back in class. That's probably not as much of a problem for a kindergartner, because a kindergartner isn't really missing essential work yet. So it's certainly something to be keep in the back of your mind. It's certainly something that you can discuss with your school, and schools do handle it differently. But unless he's missing a lot of class time for things, I wouldn't think he would need a 504 plan quite yet in kindergarten. But perhaps moving forward, he will. So you could open that conversation with your school. Generally, there's an administrator that's in charge of 504 plans at a school, and you can certainly start that conversation, but just know that it's probably not something that needs to be done, in order for him to be successful in his early years in school.
Thanks for that, Leslie and Stephanie. Hopefully that helps with your question. We have Stephen joining us from Kansas City, Missouri. Scott, your old stomping grounds there. Kate from the UK, and Tobias from Norway. So appreciate everybody.
Oh, hi, Tobias. I've spoken to you.
Look, a connection here on Facebook.
Yep.
So a lot of the conversation has been dedicated specifically to nosebleeds. 90% of HHT patients have them, but as we know, HHT is much more than just nosebleeds. Scott, in terms of scans and staying on top of scans, even when children may be asymptomatic outside of nosebleeds, any recommendations or best practices you would share with everybody?
Yeah, I think I would take one step back even before talking about scans, and that's genetic testing. If somebody has a known diagnosis in the family, it's very helpful for that patient, the family member, to be genetically tested, find a mutation, and then you can test your child. As soon as they are born, you can. Excuse me. You can. You can check that person, right away, the child, and then see if other scans are necessary. Now, if the genetic testing is positive, or the child has signs and symptoms of HHT, or maybe genetic testing didn't find a mutation, or if for some reason family's not getting tested, then the scans are necessary. And we typically look at testing for lung AVMs. Many people use bubble echoes for that. There are some physicians who use other testing diagnostic measures, and also for brain AVMs. But those, it's very important to stay on top of those. It used to be thought that if you scan the brain in the child once, and you found nothing, probably didn't need to do that again. We, like many things with HHT, our information is evolving. We now know that you can develop brain AVMs later in life if you've had a negative MRI as a child. So you need to talk to your HHT physician about when to rescan. But clearly those are the two, as you mentioned, the two catastrophic things that hopefully can be events that can be prevented with proper screening.
Absolutely. A great reminder for everybody. So thank you for that, Scott. Please feel free to continue to ask some questions. We have one here from Jamie. Leslie, you and I were talking a little about physical activity with PE, and this maybe can be for both, but Jamie asks, hold on, let me scroll back up and find it here.
The football question?
Yeah, it was a question about
Yes,
the heat and the
that.
heart
In
with
Texas.
HHT involvement. Here's the question. Anything to be mindful or aware of in regards to the heart or the heat? My teenage son has HHT and is an athlete playing football in Texas.
Well, and it looks like someone below had some really good ideas. Chelsea and obviously has some experience with this. And hydration, I would always say that with hydration, and hydration isn't a whole bunch of Gatorade. Some Gatorade's okay, maybe half strength Gatorade, but kids also should be drinking plenty of good old fashioned water. And if they don't like it, as I said, half strength or quarter strength Gatorade is fine, but they should be drinking plenty of water, and particularly if they're practicing in the heat. And Chelsea suggests putting some sort of ointment on a cotton ball, sort of prophylactically, rather than waiting for a nosebleed to start, because I know temperature can be a big problem for kids with HHT, with nosebleeds, and that can really accentuate them a lot. So yes, that's a good idea. Thank you, Chelsea, for that. You obviously dealt with this problem. Yes, you're saying electrolytes. Yeah, so it depends on how long they're out in practice. I mean, a lot of schools do have a sort of a heat advisory, so that kids can, they shouldn't be out in the middle of the day for several hours. So yes, electrolytes are important to replace, but just lots and lots of Gatorade but no water can actually be dehydrating. So you don't want them just to be replacing their when they're sweating a lot, just replacing that with Gatorade. So like I said, half strength Gatorade is usually a good choice. So I'm trying to read this at the same time. So yes, preventative care is key. Yes, that's right. Try to keep that from happening.
Absolutely appreciate that response, Leslie. Steven says when he's active, his blood gets pumping and his nose will bleed more. I know that's certainly something that can happen as well. Scott, I know you only have a few minutes left and have a hard stop with us here. Sort of wanted to close with turning it over in the floor with you all. Are there any other tips, recommendations that we didn't cover, or maybe you want to touch on what parents can do to spread awareness? I think, as we can all attest to, you can never underestimate the power one conversation can have. But Scott, any closing or departing thoughts?
Yeah, I think anytime you can raise awareness, it's obviously a good thing. And if you're talking with your school nurse, you might want to mention again what HHT is, obviously, when you're talking about your child. But empower the nurse to maybe find more patients and potentially, it's not an exaggeration, save lives, right? Child who comes in, history of frequent nosebleeds. Just something simple like asking if there are other family members who experience frequent nosebleeds. Something like that could at least raise the possibility of HHT and get somebody tested and really change the course of somebody's life potentially, or an entire family.
Absolutely. Thank you, Scott, and appreciate you joining us here today. Leslie, any closing thoughts from you?
Yeah, I mean, the school nurse really is your friend. He or she really wants your child to have a good time in school and a good experience and be successful and reach their potential. And, my job is to sort of get rid of some of those roadblocks. And, I'm happy to help any way I can and within the confines of what I can do in a school building. But talk to your school nurse. I would also suggest emailing or calling ahead of time. Just showing up in my office sometimes doesn't work very well, because sometimes things get really crazy in there. So it's easier for me if I know I can, have a meeting with you. We can plan a time rather than just showing up. But if all you can do is show up, just show up, and we'll try to make time for it that way too. So I try to be flexible about that. So, but yeah, talk to your school nurse, because that's what they're there for.
Absolutely. Leslie, Scott, I appreciate your time here today. Hopefully the community found this session helpful. Again, as a reminder, be on the lookout for our HHT kind of overview and nosebleed best practices guide. That should be up and available to you soon. Sorry we didn't get to all the questions here today. I'll jump into the comments and hopefully get to many more of you there. But for everyone here today, wishing you and your children a successful school year.
Thank you.
Thanks, everybody.
All right. Bye.